Business Day in partnership with Endeavor Nigeria. So essentially, Scaling Through Crisis features inspiring entrepreneurs as they meet this challenge head on. We amplify the stories of the small business owners, startup founders, and scale-up entrepreneurs that are thinking big and finding opportunity in crisis. This show, like I said, is brought to you by Endeavor, and Endeavor is a mission-driven global organization that believes that job creation and innovation and overall prosperity flourish where there is robust support for high-impact entrepreneurs. So my guest today is Temie Giwa-Tubosun, who is the founder and CEO of LifeBank, which is Africa's healthcare supply and chain engine. So Temie, welcome to the show. We're very excited to have you on the show. You have been extremely busy during this pandemic, so we appreciate you taking the time to speak with us today.
Thank you for having me.
So welcome to Scaling Through Crisis. Temie, could you start by telling us a little bit about LifeBank, your company?
Right, so LifeBank, we call it a medical distribution company. We basically help hospitals find the critical supplies they need. So it started with a passion for blood, passion for mothers, and blood is such a critical thing of a critical supply in ensuring women survive childbirth. And of course, started with that passion around distributing blood to hospitals, and then it grew. It grew to oxygen. It grew to medical supplies like medical consumables. So it just really basically grew from there to distributing all the critical supplies that a hospital would need to save their patient's life.
Fantastic. I mean, LifeBank is definitely doing important work. So you mentioned that the company was founded through a passion for mothers. Can you tell us what made you decide to start a company like LifeBank?
Right. So I've had some professional and I would say professional and intellectual passion for women, particularly the health of women. And it didn't become personal until I had my son 6 years ago. It was a very difficult birth, and it was through his birth that I had sort of like an emotional connection to the problem I had been solving or I've been trying to solve with my career. So I've always worked in international organization, policy, I worked in government, always sort of like creating systems. And then I felt like I wasn't, getting my hands dirty enough, and that I wanted to try to solve a specific problem. And I started researching after I was on bed rest for a while, so I had nothing to do. So I basically just started researching what was killing women in childbirth. And I basically found something called postpartum hemorrhage, which is sort of the highest cause of maternal death in the world. It isn't something that affects just Nigeria or just Africa. It's sort of like around the world, around the entire developing world. Basically, a mom gives birth, and then within a couple of minutes of the birth, she starts bleeding, and she bleeds. And the interesting thing about postpartum hemorrhage is that it's catastrophic, meaning that it causes death quite painfully. And then also it's quick. It's a very quick way it's the quickest way for maternal death. So between 20 minutes to 2 hours, a mom is dead. So that was sort of like the problem. That was the main thing I wanted to solve. And the final insight that I think helped me start LifeBank was between 8 out of 10 women who die in childbirth from postpartum hemorrhage could be solved by just bringing blood to the hospital. That was it. So I felt like we could build a distribution system focused on blood for mothers specifically that delivers blood around the clock. And that was the idea behind LifeBank.
Wow, I mean, that's a very touching story, but also it's a very real one. And I'm glad that you were able to see the problem and try to, bring a solution to it. So I definitely look forward to talking more about your entrepreneurial journey towards the end of the program. So, I'm speaking to you from my house. You're speaking to me from your home. It's COVID-19 pandemic has taken over the world as we know it. In the intro, I alluded to the fact that LifeBank is doing some very impactful work So I'd like to first start by asking you, how is the pandemic affecting you as a person and also your business?
Oh, the pandemic. I basically had to learn to lead all like completely from scratch. I'm sort of like a face-to-face type person. So I like to see my team. I get energy from them when I see them. They give me, I give them some of my positive energy. So we do a lot of meetings. Before the pandemic, I love spending time at LifeBank. It was apart from my home, it's probably the second happiest place for me. So I really just love being there with my team. We're like a very tight-knit family. And we really we care about each other, and it's just good energy. So I basically had to try to figure out how to get there, get that back, that same energy, that same tight-knit. And we struggled in the beginning, like WhatsApp, Slack, all of those things are not like having a conversation and looking someone in the eye and being able to communicate and come to so it was really difficult. Personally, I had to do a lot of work. So while everybody was locked down, I had to not only work as hard as I could, and I feel all women, all professionals have to work at home, but also we have to take care of children. I've got 2 kids. I have to look after them. They were out of school. They even actually got out of school a little bit earlier than I think the rest of the city. So we had been stuck home for a very long time and had to look after their school. And so it was hard. It was a lot of work. And also it was an emotional time. I tweeted a couple of weeks before shutdown that I was quite surprised that my son knew very much about COVID-19. He knew that he could die, and he's 6 years old. And I remember talking to him, and I was completely surprised how much he knew and how afraid he was. I wasn't paying attention. So it was really hard. But I think I like to say that we were made for times like this. Everything in our past was preparing us for this. And I'm really glad that we've been able to, at least at LifeBank, we've been able to do our duty. We rose to the occasion, and we did what we had to do.
No, I mean, you absolutely did what you have to do. So you and Beyonce have one thing in common. A very amazing tweet that I wish I could pull up, but essentially you both have brought testing capacities to your cities. So for those of you who don't understand the context of what we're talking about, Beyonce Knowles is an artist, and she is from Texas, and she set up testing facilities for people in Texas. And Temie, our very own Beyonce of Nigeria, have also set up testing facilities, mobile testing facilities. You were actually the first to set up mobile testing facilities in the country. So that's a huge achievement. So congratulations for that. So tell us about these testing facilities for COVID-19.
So, my day job is to run a distribution business. I am in healthcare, so I do know quite a lot of people in healthcare. And to be quite honest, we had to partner with a government agency called Nigerian Institute of Medical Research, NIMR. And NIMR, we had a relationship pre-COVID. We were running some clinical trials with them, mostly around blood safety. And we already had a sort of like a rapport with them. But so I needed a test for somebody who was very close to me. And that person had traveled, he had finished his quarantine for the 14 days, but there was intense need, emotional need to figure out whether you're, positive or negative. And he had that need. And because I was in healthcare, I called around and I figured out that NIMR had the capacity to test. So I asked them for a test. And it was through that process that I realized that, other families, other people, other professionals wouldn't want the same thing. I wasn't actually thinking about people who were already positive. I was just thinking about people who wanted to know whether they are positive or negative. And I wasn't thinking about people with symptoms or anything like that. I just wanted to help more people because I got this help and because I had this access. So we were having this conversation and it came to us, and NIMR, I was able to meet with the leadership of NIMR, and then they were like, oh, we could do this. And I said, what about a drive-through? They had a parking lot across the structure in Yaba. And that parking lot, was absolutely empty. It was very large. And I was like, we can set it up here. And we had a conversation. Within 6 days, we were up and running, and we got our first patient. And I was so surprised at the amount of interest and the amount of, we've been able to test over 2,600 people in this tiny facility. I've been surprised at how much we've been able to do. And of course, we didn't stop at Lagos. Lagos is actually not my hometown. So I wasn't actually referring to Lagos in my tweet. My hometown, where I grew up, is Ibadan. So after the 9-month testing facility, I got together with Citizen for Citizen Initiative, which is run by Mrs. Awoshika, who's also, an Ibadan native. And, we partner with them. They funded our facility, and then we partner with the Oyo State government, and the three of us work together to open. With NIMAS also providing some advice for us and some strategic help. So the 4 partners came together and opened a facility in Oyo State, which was what I was referring to, like, well, I'm now Beyonce. I can't sing, but at least I have something to come up with that.
That's really fantastic. I mean, it's really amazing that you've been able to use your healthcare background and to really make a difference. So can you walk us through a little bit how these testing centers work? So if someone wanted to get tested at one of these centers, what would the protocol be?
Right. So previously you had to meet what was called the case definition. So basically you have to meet a certain standard set aside. The standards were set by the Nigerian Center for Disease Control. But recently, I think they've relaxed that completely because of what we call community transmission. So basically, in the beginning, you only got COVID-19 if you had traveled or if you had direct contact with someone who had traveled. So that was that was the case definition. You needed to have travel history, and you needed to either have travel history or contact with a confirmed case. So in the beginning, it was sort of like, people were interested and we couldn't really test them because they didn't meet the case definition. But recently, since community transmission is so significant now, the majority of cases now have no travel history whatsoever. It means that you can't use that to determine who get tested or not. So they relaxed that. So basically, if you're interested in getting tested, you just go on our website, or either you call your state NCDC hotline, or you call our website, or you go to the NIMA website, register, and if you meet certain standards, you're called to get tested.
Okay. All right, so I hope that's helpful for those of you who are watching. So Temie, I'd like to talk a little bit about leadership in crisis. So it seems as though you've had to step into a heightened level of leadership, especially given this COVID-19. So talk to us a little bit about that. What are some of the things that you're learning about leadership in crisis?
I struggle with the idea of me being a leader. Right. I think that everything that I've ever done that I think has thrust me into the public eye or thrust me to a different level of where I was, I have been reluctant. It's the funniest thing when I tell people, even being an entrepreneur, I was completely reluctant. Every time I remember when every major milestone, I remember the first time Mark Zuckerberg tweeted about or mentioned LifeBank on his live, was doing some Facebook Live. I remember basically turning off my phone, switching off my email, I drove down to Ibadan and hid out, in this tiny little house with my family until it was over, and then I came back and went back to work. So I'm not like the most, I don't like the attention. I don't have a natural inclination to push myself for leadership roles. I always feel like what happens is I just happen to have some skills that, so leadership is one thing, but I think duty is another thing. So I've always felt like I had a duty to Nigeria, a duty to Africa, a duty to my community. And I think that duty is what drives me, not like a need to be a leader. So I think for me personally, it is the way that I see leadership, if you will call me a leader, the way that I see my leadership is doing my duty and using the skills that I have, the experiences, the expertise that I have to help my country because it's my duty. Yeah.
Okay. No, I mean, I can definitely understand the shyness around the attention, but like you said, your duty sometimes comes in the form of leadership. So I'd like to talk a bit about, the internal runnings of, so I guess what I meant by leadership was more so in terms of the way that you've been leading your company, I guess like internally during this crisis. So how would you say that your leadership has had to change? So, you mentioned how you love having face-to-face meetings. People at this time are emotional, things are a bit uncertain. So let's talk about leadership from that perspective. I guess leadership from an internal leadership perspective.
Absolutely. So as a leader, I believed in serving my team and coaching them. I have a very young team, but they're absolutely passionate about LifeBank. They are Team LifeBank. They push me to do better. Maybe that's why I love that energy at LifeBank, but because they're simply, when I have doubts, I go to LifeBank and talk to a couple of them, and they're the ones who sort of like get me excited and get me focused, and they get me to keep working and keep doing the work. So having to sort of like switch that and then actually be the one to now speak to them, inspire them, calm them, tell the truth, but not too much where, they're getting really worried, was really difficult. But I think I had done a lot of work, before COVID-19, I like to think of being a leader, or being a leader as building into people. So depositing positive thing, depositing mentoring and modeling good behavior to them. And I think that really helped us. For example, we have two separate teams. There is the fulfillment team. They're the riders who are out there 24/7 delivering these critical supplies. And then there's sort of like the support team, the finance, the tech team, the ones that are supporting the business.
Okay. Yes.
Yeah. So the fulfillment team, the call center, the riders, and all the operations team, they had to keep showing up at work because we are essential services. So minus our COVID work, the core team of LifeBank had to keep showing up at work because babies who need to be delivered don't know that there's COVID-19 and they should delay their delivery date.
Right? Thank God for that they don't know that.
Right, exactly. We don't want that.
Yeah.
Yeah.
Okay.
And so I had to basically inspire a bunch of people who had to leave their home because they couldn't actually, because of the shutdown, they couldn't go up and down. So they had to live in the office, and I couldn't live with them because I'm not essential staff. So I had to basically take from all the things I had deposited earlier and use that to sort of inspire them and get them to commit to staying at work and doing the work on behalf of our country. And I think what helps is that the same idea of duty, the same sense of duty that I mentioned is what I've tried to instill and inspire in them. That they're not here to make Temie rich. They're not here to do anything like that. They're not even there to help our shareholders, be rich. What they're there for is to save people's lives. And because they're like the direct link between LifeBank and the patient, they speak to the patient, they speak to the medical team, they feel themselves like their medical team. I think they were willing to do the work, and I'm so incredibly proud of them. I feel emotional about the sacrifice. They literally didn't go home for over 3 weeks. They all stayed in the same office doing the work in all the locations across Nigeria, and I'm just proud of them.
No, absolutely, and I think that people are now starting to have it. Not that the respect wasn't there for the medical field, but I think there's a heightened level of respect I think when crisis like this happens, people really realize what's important. And we must really commend, all the health workers in Nigeria, all around the world that are doing this amazing, very important work. It's not easy to be, like you said, out and about when there's a virus around. I always say, being able to work from home is a privilege. So thank you for the work that you guys are doing at LifeBank. It really is important. And I hope that this crisis will also inspire other people to start other essential service businesses, so impact-driven businesses. So speaking of impact, you won the Jack Ma Entrepreneurship Award earlier this year.
Last year.
Late last year. So congratulations, that's really huge. So tell us a bit about that. What was that like?
It was really cool. I mean, I met Jet Li as someone who was, that was like the highlight. I was like, oh my God, Jack, hey, Jack, Jet Li. Bye. And I was like, Jet Li, oh my God. But no, like it was really great. First I was part of like this incredible list of amazing companies doing really incredible work across the world. I felt like, oh my God, how do I even compete with them? But, the reality is we're all winners. Right. I did the work. I studied. I remember I had pitch by heart. My assistant, Aisha, will call me in the middle of the night and say, take the pitch again. And then I'll do it. And she'll be like, and she was like, she's really tough. And, she would get me to like do it over and over until I had it, by heart. I could say the entire 10 minutes off the top of my head and just do it. And I think also like people were really interested, and the team, Ms. Awushika was on the stage, Jack Ma was there, Josai was there, there were so many leaders across the world who were on that, who were helping us that day. And for me, I think they were really interested in the elegance of our model, in the simplicity of the model. So our model is very simple. We just move one thing from point A to point B. It's really like, it's not, of course we use tech, it's tech enabled, it's actually more complex than that. But literally when you're looking at it from the outside, it's like, oh, they moved this to this, but the impact is immense. It's literally, LifeBank stands in the middle of someone, a member of our community, and death. That's it. They're about to die. We show up, we give them what they need, and they survive. And it's incredible. When you enter our office at LifeBank, you see little red arts on the wall. And in that little red heart, we have the first name of the person whose life we saved. So we have about 8,300 little red hearts on our wall in the office. So maybe that's one of the reasons why I love my office so much and I miss it. But when you enter the
1,000 lives, I mean, that's huge. That's huge.
It is. But we didn't say we get to 10,000 to really celebrate. We're going to shut the city down and really, really go out there and celebrate when we hit that 10,000 lives. Yeah.
Absolutely. And we look forward to celebrating that with you. So if I can ask, what is your goal? Do you have a number that, LifeBank by X amount of a year, I want to have saved X amount of lives?
We don't have that. Maybe we should set that, but we don't have that. I think what we just want to do is, we've been 24 hours, 7 days a week since we launched. So we're about 4.5 years old and we've never shut down. And we want to just continue that. It's a very simple goal. It's very boring. We're very simple people at LifeBank. And what we just want to do is make sure that we're doing our duty every single day. And that when we show up, we're relentless. We are driving excellence in terms of, we want to be operationally efficient. We want to be, efficient across all standards so that we can just keep the lights on, right? And help as many people as we can. Of course, our big dream is to expand, right? We are currently in 5 cities in Nigeria. We're in Lagos.
Yeah.
Sorry?
I was going to say, could you name those cities?
All right. Lagos, Abuja, Port Harcourt, just launched in Ibadan and about to launch in Kano. So we already, we have presence in 5 cities. We're working on, we just hired a team out in Kenya, looking to expand to Kenya, looking at Ethiopia, looking at Cairo, looking at so many other markets. So that's what we want to do. We want to expand and keep the light on and continue to drive that impact every day.
Mm-hmm. No, fantastic. We definitely look forward to seeing that Pan-African expansion. So speaking of expansion, as you know, any business needs finance to be able to expand and to scale. So I'd like to talk a little bit about that before we delve into a little bit about your personal journey before LifeBank. So talk to us about raising finance for your business. How did you start LifeBank? Did you start it? Did you self-start it? Did you get finance in the beginning? Talk to us a little bit about that.
Mm-hmm. Yeah, I raising money for any company is difficult. There's no two ways about that. Like, it's hard to raise for any company. It's harder still to raise for an African company. It's harder still to raise for a healthcare company. It's even harder to raise when you're a woman. And then when you're a sole founder, right? So there's so many things, yeah. So it's like, co-founders and sole founder. Right. So it's really, 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 hard out there, to be honest. I think for us, we've raised a couple of rounds, 3 significant rounds. We raised a pre-seed. When we launched, we raised a seed round, and we raised a couple of other bridge rounds recently. And we're in our Series A process now. We're raising a Series A, and it's going pretty well. For when we launched, I started the business and I built the platform, with money from my pocket, because it's really important to show skin in the game. And I remember when I spoke to the first LifeBank's first ever backer, which was CC Hub, and they're like, "Oh, you gotta quit your job." Oh, and I remember when they told me that, and I had a great job. I really liked my job. I wasn't unemployed, at all. Like, I had a good job and I was very good at it. I was actually making movies. I was making health movies, and we would sort of like had like product placement, but a medical message in popular Nollywood movies. And I really had, it was good. Like, I hung out with like celebs all the time. I hung out on movie like sets, and it was really fun. I liked it. And I read scripts, and then I got to do healthcare too, health messaging. So it was really fun.
It was a combination of all your passions, basically.
Exactly. So it was really good. I liked my job, and I was paid very well as well. But I knew this LifeBank is my life's work, and I basically went through a long process of making the case for why I should quit my job and start LifeBank. So I started LifeBank, and it's been incredible. When I went back to them and said, "Oh, I'm ready to quit my job," they were really surprised. They're like, "Wow, okay." And then they signed the first check to LifeBank, which was kind of like our pre-seed. And then we sort of like started growing ever since. Yeah.
Wow. So you raised that amount, and then you've kind of been just growing ever since.
Yeah.
And then you've been receiving things like the Jack Ma Foundation Entrepreneurship. That was a prize? It wasn't a grant.
It was a prize. Yes, yeah. We've actually done very well with prizes, but not very well with grants. Surprisingly enough, we've done very well with winning those sort of prizes that allows you to sort of like plug the hole until you're ready for the next round. Yeah.
Okay. And in terms of positioning your business for financing, I mean, obviously LifeBank, I think it kind of sells itself in a way because it's such an essential service, and it's it's kind of obvious why investors would want to invest in that kind of business. But for the startups who are watching, entrepreneurs that may be wondering, how to position themselves. Maybe position is not the right word, but I guess like how do you build a business of value that attracts investments?
Right. So, there are impact investors and they're just pure investors. When I tell you that most of our investors are pure commercial investors, pure equity plays, and not impact, people are constantly surprised. The reason why is that we built a model that is profitable, but also impactful. So the way we describe LifeBank is in the business of saving lives, right? The business is the first thing. So you hear it first. It's the business of saving lives. What we do saves lives. So what we actually do has impact. But business comes first. And it's pretty important to have that business bit come first. So we're in the business of saving lives. Business comes first. Then the impact also comes after. And I think that's why we've been very successful in getting investors to be interested in our work, because investors ultimately want value. They want to make sure that they get returns on their investment, and they don't want to just give money. It's not a grant, it's not a prize, it's right. A investment. So we have to make sure that we're delivering that value to our shareholders, but at the same time do impact. So the way we've been able to build it is, for every value we're getting, there's a direct impact linked to it. So we don't need to do anything special to get impact. Impact is built into our model, and then the value, the financial value, also is built into it. And that's been why we've been moderately successful in terms of getting investors.
I like the humility, moderately successful. That's but I think it's an important distinction that you make. So for the audience watching, impact investing is an investment whereby you want to create impact, but you also want to generate a return. So I think the distinction is very important, because people get it confused a lot of times. Impact investing aims to have both a financial return and impact on society. And I have a huge feeling that the investing landscape is going to change dramatically. And what we considered impact before, I think, is going to change a lot, especially in the healthcare space. Okay, so thank you for answering that question around raising finance. I'd like to talk to you a bit about your journey before. I know we've talked about it a little bit, but I'd like to dive into that, because I think there's a lot that people can learn. So walk us through your career before starting LifeBank. I know that you have 10 years of health management experience in the UN, Lagos State Government, World Health Organization. So walk us through briefly a little bit about that. And also, if there's any lessons that you've learned from your previous experience to what you're doing now, also kindly tell us about that. Right.
So I've had this interest in healthcare, but I'm not a healthcare person. I have absolutely I didn't even study science. I studied political science as an undergrad, and then I studied management for my master's degree. So after I was done with my master's, I knew I was going into healthcare, because before I was done with my master's, I grew up in the US, so I had my master's in the US. So between year 1 and year 2, I had this 3 months when I came to Nigeria and worked in Kano. And it was sort of like my experience there that in Kano's ministry, in Kano, Kaduna, Jigawa's health system, that got me super interested in doing health system work in developing countries. So after that, I went to work at the World Health Organization doing health financing. So first I wanted to know, how do you finance a health system? What needs to go into it? How do you actually build out the financial systems for a medical system? So then after that, I went back to the US. I did some health tech work, basically was doing some work around Epic systems and helping hospitals in the US, register on the Epic system. And then I got a gig to work in Uganda, in East Africa, to do some health supply chain work. So again, different parts of, I think I was just sort of interested in all the different different systems and sectors that make up a full health system. And then when I decided, after Uganda, I got married to a great Nigerian guy. And so we decided to move back to Nigeria and live here. We basically came here to get married and then just never left. I went to work for Lagos State, again in healthcare, in operations management for what is called a SIMA now. It's basically facility management. So I worked there for a while, and then I went to the Nollywood job that I mentioned. Basically, all the different parts of healthcare. And I was just curious. I was curious about the system, about how, what are the things that need to be there so that a doctor does his job well, so that a nurse does their job well, so that, a lab scientist, a pharmacist, all the different, service delivery portion of healthcare. What are the things that are around it that make sure that when doctors are in the hospital or when someone's at home and interested in learning about healthcare, they're getting the best service ever. Mm-hmm. So that was my interest. That's my professional interest. So that's sort of like in terms of how that has helped LifeBank. It's basically just training. I like to say that everything in previous to LifeBank, everything before LifeBank was training me to run LifeBank. And it's just been, it's incredibly useful. The amount of technical and real life experience that I've had in building and changing health systems.
No, I mean, it really seems like you got all the experience that you needed, and that kind of led you to creating LifeBank, and it seems like you've been able to garner all the experience.
However, I would like to point out that a lot of these things don't make sense in as you're living your life. I didn't set out to say, oh, I'm gonna get this experience and this experience. I'm not like a genius in that sense. Like I didn't set it out. My life it makes sense when I'm thinking back at all the different things I was doing. So I don't want everybody out there to say, okay, oh, I can't do this if I don't have all this experience. No, that's not what I'm saying. You probably have all the experience you need to do whatever it is you want to do, whatever you feel called to do. I say that, God does not give you more than you can handle. So you've probably been trained already on a lot of the things that you need to do, or at least in the fundamental sense of that. So don't feel like you need to be, I mean, I wasn't a medical doctor, and a lot of people didn't believe that I could do it because I didn't have this medical degree. But I didn't let that stop me. I felt like I already knew the fundamental portion of how to build a structure, and everything else that I didn't know, I learned. Right. So I learned from the job, and that's what I think you can do too. Yeah.
Fantastic. And I'm glad that you make that distinction. We don't want people to think that you have to have all this experience, but so I guess that brings me into the Q&A session of this. So in terms, you talk about, alignment a lot. I've heard you talk about this throughout this conversation. So what advice do you have for young people who are looking to find their why, or they're looking to find what that thing is that they really want to be doing? What advice do you have for people like
that? What can you not stop thinking about? That's it. I couldn't stop thinking about why women were dying in childbirth. It was special to me. I don't understand. It was before I was a mother myself. I just couldn't stop thinking about it. It seemed like an injustice. You were doing, here you are, you're a fully grown woman. Your parents had done, all they needed to do to keep you alive until your adulthood. And now you want to bring out life to the world, give the world a gift. And then something very silly, something not really difficult, then causes the death. I just think it's an injustice. And I've always felt that way. Ever since I discovered, personally found out that women died in childbirth, I have always felt like it was a special injustice. That, you have all these hopes and all these dreams for your child, and then you just die. Like on that moment, you're right at the cusp of it, of having this miracle happen, and then you die. So I couldn't stop thinking about it. No matter how much I tried, no matter how much I wanted to have a really nice life and a nice job where I can go to the spa, I really like the spa, where I can really enjoy my life. I just couldn't stop thinking about it. So I think whatever you're called to do is what is a problem you can't stop thinking about. For me, I think if you want to have impact, that's what it's all about. Because you're going to need it, and you're going to need that passion, and you're going to need that commitment. because it's gonna get hard when you get to sort of like the 12, the that part of building where you feel worse and you feel terrible, and you're asking people to, why won't someone fire me? You can't even quit, but you're looking for somebody to say you're fired. When you get to that level of not feeling competent, what you're going to need is that passion. What you're going to need is that commitment to solving a specific problem. So what I always say to anybody who wants to start is make sure that the problem you've chosen to solve is a problem that you care about, because you're going to need to have that care when things get really hard.
Mm-hmm. I mean, I think that definitely makes a lot of sense. We have a question here from Coyote. He's asking, LifeBank has been able to decrease blood delivery time from 24 hours to less than 45 minutes. Why did blood deliveries take so long in the past?
Yeah, that's a good question. I think that what the reason why it took so long in the past is multifaceted, right? First, you have to know who has the stock, right? Which of the blood bank? There are about 100 blood banks in Lagos. I think even more. So you first have to know who has the stock. You don't know who has it. There's no way for you to know who has it before LifeBank. Then you have to make sure that you can reach them, right? And usually, babies don't come on schedule, right? So you have to make sure that you can't schedule your childbirth at I'm gonna have this baby at 2 p.m. on Thursday. Right? Like you can't do that. So you simply have to. They don't come on schedule. So when you need it, you have to make sure that the blood bank, you can reach at least one blood bank, and it's hard. A lot of blood banks before LifeBank, they run 24-hour service. They didn't work on weekends. On Sunday morning, they are at church. Some of them are in the mosque, on Friday, and you really can't reach them. Some of them go to the bar and, they're drunk and they can't pick up their calls. And, that was what was happening. They're human beings, they have lives. So they go live that life and they're not available to patients. And then you have to actually, so let's say you're lucky enough to get the blood. Then you have to now find how it's going to get to you, to wherever you are, quickly enough and in the right condition. And that right condition is important because blood has to be kept cold throughout its life cycle. So from the time it's removed from someone's vein, it has to be put in a cold environment until it's actually transfused into someone else. So you then have to make sure that whoever is bringing it to you, has the right cold chain system so that it's not terrible by the time it gets to you, because that happens often. And then and the last part of that is you also have to make sure that there are enough blood donors. So first you have to make sure that the blood actually exists. So that was why it took so long. That was why it took forever. And all the problem that I mentioned is literally all the things LifeBank has built to solve it. We had to build an inventory system so that blood banks can tell us the inventory they had. We have to make sure that they're open 24 hours because we are open 24 hours. Then they decided to start opening 24 hours themselves. Then we had to build a distribution system. We had to make sure that all the distribution system are cold chain. We had to get blood boxes, specially designed. We had to get Bluetooth padlocks. We had to get temperature strips to monitor the temperature of the blood when it's been distributed. And then finally, we had to make sure that there's enough blood donors, that can give blood into the system. Although we're not a blood bank ourselves, we have to make sure that at least our blood banks have enough supply. So those are the things we had to do to make sure that we get that time from 24 hours down to 45 minutes.
Mm-hmm. Okay, well, thank you for that. Speaking of inventory, I know that you have started a COVID-19 inventory. Can you talk to us a little bit about that?
Yes, so we had to, there are critical medical supplies that are needed in COVID-19. There are critical equipment that are needed to treat COVID-19 patients. So we wanted to do some work around gathering those information and putting it in. Literally a lot of the things that hurt Nigerians, either in healthcare or education or whatever, it's just putting resources in one place where people can't see it. Sometimes you just don't know what's going on.
Right.
Transparency, or it's not even, people are not trying to hide. Sometimes I find out that they're not trying to hide the information. They're simply not aware that other people may
made
need.
available. It's just not made available for public knowledge.
Exactly.
Okay.
So getting all this information, disparate information, and putting it in one place is so important. And that's what we've been able to do. So we simply just said, okay, how do we gather inventory information, and how do we make sure that things are available for people who need it? Yeah. And so what we did is we gathered equipment information. So we found all the ventilators, respirators, ICU beds across Nigeria. We started moving oxygen. So our oxygen delivery system we called LifeBank. So we started delivering oxygen to isolation centers where COVID-19 patients have been treated.
Okay. And can you give us any updates on what those numbers are, or where can people access that information?
In terms of the ICU beds and equipment, right? So the service is called QUIP. You can find out how many we found at quip.lifebank.ng. This service is also available in Kenya at quip.lifebank.ke. So you can really just go on those sites and you can find which states and how many units of isolator, ventilators, respirators, and then the ICU beds. So you can go and check it out. We're not sharing that information to the general public, but we share it with the isolation centers in case they need it.
In case they need it. Okay, so at least they know where to get it if they need it.
Exactly.
Okay, Temie, so we're coming to the end, almost to the end of the show. It's been an hour, but it's gone by so fast. It's been really interesting and speaking to you. And I wonder if there's anything that you'd like to leave our audience with before we end the program.
Right. I just want to say to everybody that, greatness is evenly distributed. I don't think I'm special at all. Of course, Beyonce is awesome, and I'm trying to be just like her. But I don't think I'm special. I think simply all I did was lean into my duty and lean into my responsibilities as a Nigerian to try to help the country as much as I can. I think that if we all decide to fix a small part of our country, that we will all get a good country. And I think that businesses with a social impact at the heart of them are the best way. Starting businesses that have impact built into them are probably the most best way to do it. So I think that's my message to the world. We should all get together, do our duty for our country, for our community, figure out the problems we are called to solve, and basically throw yourself into it, and hopefully you are rewarded.
Fantastic. I mean, thank you so much for that, Temie. It's been such a pleasure speaking with you. I think you really exemplify what it means to be an impact-driven entrepreneur. And as we're seeing with this crisis and other crises that have happened, impact is really where we're able to have our imprint in the world. So if you can have impact and make money while doing it, why not? So Temie Giwa, thank you so much for taking the time to come on the show, Scaling Through Crisis, brought to you by BusinessDay and Endeavor Nigeria. And we really look forward to keeping in touch with you. If people want to stay in touch with you, can you tell us your social media handles? Is there any, if people want to email or get in touch?
Yes. So if you want to get in touch with me, I'm on Twitter at TEMITE. I am, that's probably where, that's where I spend my time. You can also shoot me an email. It's Temie with an E, TUMIE @lifebank.ng. Thank you.
Cool. Temie, thank you so much. Please do take care of yourself and keep us updated on what's the amazing work that LifeBank is doing.
All right. Thank you so much for your time and for having me. Have a very great day.
You're most welcome. You too. Take care.
Yes. Bye.
Bye. All right, guys. So thank you so much for tuning in to another episode of Scaling Through Crisis, brought to you by BusinessDay and in partnership with Endeavor Nigeria. I had such a great time speaking to Temie Giwa-Tubosun, who is the CEO and founder of LifeBank. LifeBank is doing amazing work pre and during COVID-19. So I really encourage you to check out their work. They deliver essential medical services to medical facilities around the country. They are in 5 locations. So just go to www.lifebank.com to check that out. Again, my name is Lehlé Balde and I work with BusinessDay Media. It's been a pleasure speaking with Temie today, and thank you all for tuning in. We're having another episode of Scaling Through Crisis tomorrow at 2 p.m. West African time. So please make sure to tune into that. And we also have a great lineup of interviews for next week. So I look forward to having you guys tune into those. If you have any questions about the show, if you have any comments, if you have anything that you'd like to share with us, please do so at Scaling. So Scaling, SCALING at businessday.ng. And you can also follow us at BusinessDayNG on all social media handles. And please also subscribe to BusinessDay. Go to www.businessday.ng to stay up to date on what's happening with the economy, the pandemic, politics, everything in between, businesses for SMEs. We're the go-to media house for that. So thank you, and I look forward to seeing you all tomorrow. Take care.